Perfecting the Long Case, Episode 9. In this episode, you'll be hearing some of the take-home messages for Episode 8. Dr. Zammar presented his long case at a very high level in Episode 8. Seeing this will hopefully be useful for the student to have an idea of what you are aiming for. But we would not expect a presentation like that from a student at medical school. Indeed, Dr. Zammar had some very sophisticated components to his presentation that could make a student's presentation come unstuck. For example, do you remember how he would include some of his interpretation of what was going on within his presentation of the history? Traditionally, the history part of the presentation is just supposed to be what the patient tells you, the subjective component of the long case. And the examination is the objective component. They have a murmur or they have not got a murmur. The formulation at the end is where you combine your history with your examination and introduce your medical knowledge and clinical reasoning to interpreting what you have learned. Note the great opening paragraph that Dr. Zammar gave, which really set the scene for the rest of his presentation, summarizing the key problems for John. Note also how he included John's journey in hospital up until the time that Dr. Zammar saw him, documenting the investigations that were done and the management he was given. Dr. Zammar did a great job in the detail of the history he obtained for each of John's problems. The diabetes was a great example. This is the detail you need to get to as well. Finally, note the structured formulation and then the focused problem list he presented with primarily the active issues. I would recommend as a student and junior doctor though that you include all of the patient's problems, active and inactive, in your problem list. Dr. Zammar is clearly becoming an expert at this already, or is already there. With the questions that Dr. Ingram asked, note how they were focused on management because Dr. Zammar's history and examination was so good. Indeed, the questions were at a way too high level for medical students, but hopefully it gives you an idea of where developing these skills are going to take you. Once again, as with any skill, the only way to get better at this is to practice, practice, practice.